I'm at the Idaho Urologic Institute. It's right across from St. Luke's, easy to find off of I-84, right across from Eagle Road. I'm going to visit with Dr. David Rice today. We're going to learn about the Men's Health Seminar, absolutely free, coming up on Wednesday, October 21st at 7 o'clock, right here in this beautiful facility. Let's go meet the doctor and figure out what the deal is. So tell me, who would be the people who should come to the GreenLight seminar?
Yeah, anyone who has frequency of urination, urgency, getting up often at night, or if they're told by their wife that they get up often at night to go urinate. They have trouble starting. One way to say it is anyone who, kind of knows where every restroom is in the mall. They know where every rock, stump, and bush is between their house and wherever they go. And just in general, are experiencing distress about their urination. I mean, even if they, it kind of comes and goes. Even if they think that they're having a problem, they should probably get it looked at.
Okay, so the GreenLight Men's Health Seminar is really for people who may have already identified they have an enlarged prostate, but they're experiencing some discomfort with whatever they've been prescribed to overcome it, or they're facing maybe a surgery, and this is another alternative. So what are the current options other than GreenLight to treat an enlarged prostate?
Sure. There are pills that you can take. One class which creates more room, and thus for the prostate, doesn't shrink the prostate, but creates more room and thus reduces the restriction and maybe increases the flow a bit. There are some that are and other pills that are advertised to shrink the prostate. They tend not to work for everyone, despite what the companies say. They take a longer time to work, perhaps 6 to 9 months, maybe even in a year, to know if the medicine is going to work for you. They do have some side effects as far as affecting your libido, because they affect the sex hormones. And then there are some blood pressure medicines which are kind of in the same class as the other medicines that make more room for the prostate. There are other surgeries. There's microwave surgery, there's needle surgery. There are so many surgeries, in fact, that it caused one professor to create the Society for Prevention of Cruelty to the Prostate. They cook it, they freeze it, everything you can imagine.
So why then would a GreenLight laser therapy be a better option or a different option for folks to consider when they come on the 21st at 7 o'clock to hear about it?
Yeah. The gold standard has been the TURP, the Roto-Rooter, the ream job. Most fellows have heard about it. It has been the gold standard, and now we have the GreenLight, which has all the benefits of the gold standard, less of the downside. That is, it doesn't require a hospital stay. You have less bleeding. You get to pee right away. You just wear a catheter overnight as opposed to 3 or 4 days. Your activity is restricted for maybe 10 days instead of 3 to 5 weeks. So it is a technology that has allowed us to do everything that the gold standard had done with a less effect on your life, bleeding, physiology, that kind of thing.
Can they get the GreenLight laser therapy anywhere in Idaho?
Not anywhere in Idaho, no. The institution with the most experience is here. And, it's like a mechanic. Do you go to the new guy on the block or the guy that's been there 20 years and has got a great reputation? Personally, I go to the guy that's been there 20 years and you know what you're going to get.
So what would people find at the Men's Health Seminar on the 21st here at the IUI?
Well, there'll be information, which is really one of the key things. There'll be an opportunity to ask questions. There'll be education to see if it's right for you. There'll be information that's available that they can take home to further investigate if some people aren't comfortable right at the time, and hopefully an avenue to get their life back, because most fellows, they're kind of in denial, and once they find out, or if they talk to someone who's had this done, they go, I don't know why I waited so long.